Welcome to Chapter 9 in medical terminology, the respiratory system. In this module, we're going to talk about the location and the structures of the respiratory system. You're going to define some terms related to the upper and lower respiratory tracts and to respiration. You will be introduced to word parts related to the respiratory system. We will define some common medical terminology related to the respiratory system, and then review abbreviations used in relationship to the respiratory system. From an anatomy and physiology standpoint, the functions of the respiratory system are to supply oxygen to body cells and tissues, to eliminate carbon dioxide from the body, and to provide airflow between the upper and lower respiratory tracts through the larynx and vocal cords, making human vocal sounds possible. The organs and structures of the respiratory system consist of an upper respiratory tract and a lower respiratory tract, the supply of oxygen to the lungs, and elimination of carbon dioxide from the lungs. And it'll be important for you to review the structures of the respiratory system, including the nasal cavity, nasal septum, nose, epiglottis, larynx, bronchi, bronchioles. On the right, the paranasal sinuses, the adenoids, the tonsils, the pharynx, the glottis, trachea, mediastinum, lung, and diaphragm. As we begin our journey through the anatomy and physiology, the upper respiratory tract consists of the nose and its components, the cilia, the hair-like projections on the mucous membranes inside the nose, the nasal septum, which divides the right and left nasal cavities, the paranasal sinuses, which are the air-filled cavities in the bones of the face connecting the nasal cavity. The upper respiratory tract also consists of the pharynx, or the throat, the space behind the mouth. This serves as a passage for food from the mouth to the esophagus and serves as a passageway for air from the nose and the mouth to the larynx. The adenoids are the lymphatic structures located on the posterior wall of the nasopharynx, and the tonsils are the lymphoid tissues located on either side of the throat. In this diagram, you can see the frontal sinus, the nasal cavity, the nose, the oral cavity, the tongue, the epiglottis, the sphenoid sinus, the nasopharynx, the oropharynx, the tonsils, the laryngopharynx, and the esophagus. The lower respiratory tract begins in the larynx, which is the air passageway between the pharynx and the trachea. It includes the epiglottis, which covers the upper region of the larynx during swallow, the glottis, or the vocal cords, which are the vocal structures of the larynx, the trachea, which is the air passage from the larynx into the thorax. The lower respiratory tract also includes the bronchi, which are the two subdivisions of the trachea serving to convey air to and from the lungs. The carina, which is the cartilaginous ridge that divides into the two main bronchi. The alveoli are the sac-like cavities where gas is exchanged between the lungs and blood. The bronchioles are the finer subdivisions of the bronchi located in the lungs. Additionally, the lower respiratory tract includes the lungs, or the spongy organs of respiration in which blood is aerated, the lobes, which are the subdivisions of the lungs, The pleura, which is the membrane surrounding the lungs and lining the pleural cavity. The parietal layer, which is the outer layer of the pleura that attaches to the chest wall. The lower respiratory tract also includes the pleural cavity, which is the space between the layers of the pleura, the visceral layer, which is the inner layer of the pleura that attaches to the lungs, the diaphragm, which is the muscular partition between the abdominal and thoracic cavities. The lower respiratory tract also includes the thorax or the chest, which is the anatomic region of the body extending from the neck to the diaphragm, formed by the sternum, the thoracic vertebrae, and the ribs. The lower respiratory tract also includes the mediastinum, which is the area of the thoracic cavity between the lungs, which contains the heart, aorta, esophagus, trachea, and thymus. This diagram gives you a visualization of the structures of the lower respiratory tract. Here we see the larynx, the trachea, the upper lobe, the middle lobe, and the lower lobe of the lungs, the right bronchus and the left bronchus. The bronchioles are further expanded to show the alveolar duct, the alveolar sac, and the alveolar pores, including the capillary beds covering all alveoli, and then the alveoli themselves. On the right, we see the base of the lung and the diaphragm. Respiration is the exchange of oxygen and carbon dioxide between environment and body cells. The airway is any part of the respiratory system in which air passes. Eupnea is normal breathing. Expiration or exhalation is breathing out, and inspiration or inhalation is breathing in. This is a diagram showing the external process of breathing. You can see that the chest expands. You can see the sternum, the ribs, and the diaphragm, and the diaphragm contracts during inspiration. As the chest, and then the chest expands. As the chest contracts, the diaphragm relaxes, and this is expiration. External respiration is the process of inspiration and expiration. Internal respiration is the exchange of gases between the blood and the cells. Ventilation is the distribution of gas into and out of the lungs. When we look at the combining form or word parts for the respiratory system, we see aspiro, which is to breathe in or suck in, atello, incomplete, asculato, or listen, bronchio or broncho for bronchus, capno or capni for carbon dioxide, and costo for rib. Diaphragmato or freno for diaphragm, epiglotto for epiglottis, laryngo for larynx, mediastino for mediastinum, muco for mucus, naso or rhino for nose, pectoro for chest, pharyngo for pharynx, phono for sound or voice, pleuro for pleura, pneumo, pneumato, or pneumono for lung or air, and pulmono for lung. Septo for septum, sinus, sinuso for sinus, spiro for breathe, thoraco for thorax or chest, tonsillo for tonsil, tracheo for trachea. Prefixes include M for in, U for good or normal, hypo for below or deficient, pan for all or entire, and tachy for rapid or fast. Suffixes include cell for herniation or protrusion, centesis for puncture to aspirate, ectasis for dilation or stretching, phonia for condition of voice, plasty for surgical repair or reconstruction, and spasm for involuntary movement. Some adjectives and other related terms to the respiratory system include hypoxic, which means pertaining to a low level of oxygen, intercostal, which means pertaining to the area between the ribs, lobar, which means pertaining to any lobe of the lungs, pleuritic, which means pertaining to pleurisy, and respiratory, which means pertaining to respiration. Respiratory symptoms and common symptoms and medical conditions include aphonia, which is loss of the voice, apnea, or absence of breathing. Cheyne-Stokes respirations is the alternating periods of apnea and deep rapid breathing. Dyspnea is the difficulty breathing. Epistaxis or epistaxis is bleeding from the nose. Hypoxemia is the decreased level of oxygen in the blood. Hypoxia is decreased levels of oxygen in the tissues. Orthopnea is the discomfort in breathing that is brought on or aggravated by lying flat. Pulmonary edema is the buildup of fluid in the lungs. Tachypnea is abnormally fast rate of respiration, or tachypnea is typically how we say it. Rails or crackles, and these are abnormal sounds of respiration when you're describing the sounds of respiration in the medical record. Rails or crackles is a crackling or bubbling lung noises. Rhonchi is the abnormal whistling or humming or snoring sound. Rubs is the friction sounds in the lungs. Stridor is the whistling sound heard on inspiration. And wheeze are the area whistling type sounds. Infections and terms associated with infections when we're talking about medical conditions of the respiratory system. Empyema is a localized collection of pus in the thoracic cavity resulting from an infection in the lungs. Influenza or flu is the acute contagious respiratory illness caused by the influenza virus. Pertussis or whooping cough is the acute infectious inflammation of the larynx, trachea, and bronchi caused by the bacterium Bordetella pertussis. Pneumonia is the bacterial infection and inflammation within the lobes of the lung. There are several types of pneumonia. Bacterial pneumonia is the pneumonia caused by a bacterial infection. Bronchopneumonia is an infection of the smaller bronchial tubes of the lungs. And lobar pneumonia is the infection of the alveoli caused by fluid and pus filling an entire lobe of the lung. Additionally, pneumococcal pneumonia is a form of pneumonia caused by the bacterial species Streptococcus pneumoniae. Tuberculosis, or TB, is an infection caused by the Mycobacterium tuberculosis, a bacteria that attacks the lungs and is spread through the air from one person to another. And a URI stands for upper respiratory infection and is the acute infection involving the nose, sinus, larynx, and pharynx, commonly called a cold. And we'll stop here and move to part 2.